Dear colleagues, I am Dr. Taner Yılmaz from Hacettepe University Hospital, Ankara, Turkey. I'd like to talk to you about voice masculinization today. Just a few reminders. Males speak at frequencies between 90 to 150 hertz, whereas females speak between 190 to 250 hertz. So for voice masculinization, we need to bring the frequencies below 150. Actually, it is below 130, as you will see in the following slides. This is a pitch lowering surgery. How can we lower the pitch of voice? We can increase the mass of vocal folds by injecting various materials into the vocal fold, for example. We can decrease tension of the vocal fold, which is usually the case in voice masculinizing surgeries. We can decrease subglottic pressure, but this can only be done by voice therapy. Surgically, you cannot control subglottic pressure. So most of the surgeries rely on decreasing tension of the vocal folds to masculinize voice. What are the indications for voice masculinization? Young boys who cannot masculinize their voice during puberty, they are called mutational falsetto or puberphonia, may need voice masculinization. People with vocal fold scar and sulcus vocalis have high-pitched voice, and they may need voice masculinization. People with infantile small larynx usually have high-pitched voice as well. But the highest number of patients come from female to male transgender people. In addition to that, non-binary, intergendered, butch lesbian women and gay men also may ask their voice to be masculinized, but they are rare. Highest number of patients come from female to male transgender people. What about the voice in transgender males? These males are least satisfied with their voice before hormone therapy. And they pay too much attention to their voice. They anticipate a lot of change in their voice. And the speaking fundamental frequency is the most important acoustic parameter in gender identity of these people. What do we do? What can we do for training a voice of these transgender people? First, we start with speech and voice training. The first option is speech and voice training. At the same time, hormonal treatment is given, testosterone, for about a year or two, usually not less than a year. And success is defined as the speaking fundamental frequency at or below 131 hertz. However, around 20% of transgender males cannot attain this pitch reduction. So they ask for voice masculinizing surgery. However, we have to wait for at least 1 year before going on with surgery, starting operating on these people. Wait for the effect of testosterone. Thyroplasty type 3, as defined by Dr. Ishiki in the 1970s, is the procedure of choice. It's a relaxation technique, or in other words, anterior-posterior shortening. It can be done unilaterally or bilaterally. If it is done unilaterally, you can remove a 2-3 millimeter strip of thyroid cartilage from one side and suture the thyroid cartilage back. If it is not enough, you have to do it on the other side too. Remove 1 or 2 millimeters of strip from the other side too, and then suture cartilages in figure of 8 sutures. The problem with type 3 thyroplasty is if you do it bilaterally, this middle piece is very unstable. And these are young people. Their cartilage is soft. So during suturing of thyroid cartilage, you can easily tear through thyroid cartilage if you tighten the suture a little too much. So it's not easy to stabilize or fix this middle thyroid segment to the other thyroid pieces. Bilateral type 3 thyroplasty is usually preferred, but it can also be done unilaterally. A series from US reported 8 transgender men who had pre-op 155 fundamental frequency, and it dropped to 105 post-op. So after thyroplasty type 3, you can expect 50 to 60 hertz decrease in fundamental frequency of voice. What about the disadvantages? Thyroplasty type 3 has 2 disadvantages. I mentioned about the instability of thyroid cartilage in bilateral cases, and there is a loss of thyroid prominence. Adam's apple is gone. And if he is a transgender man, then he may want this thyroid prominence. It may be important for him. This is a young man. He has a falsetto voice. He has this. So he's been receiving Botox injections to various muscles. Voice problem. So I wanted to operate on him.
Kırdağın üst sınırı ile alt sınırı arasında her iki tarafı da kapsayacak şekilde oldu. Hasta lokal anestezi altında yatıyor şu an.
Patient under local anesthesia in the middle of thyroid cartilage. So I exposed the thyroid cartilage. So at the junction of anterior incision, saw, and I overlapped the cartilages to determine how much, how long, how thick the cartilage is. And I moved it.
Veli sen kaç yaşındasın?
25.
25, değil mi? Ne iş yaparsın? Şoför. Ne taşırsın?
Yük.
Yolcu mu yük mü? Ne çeşit yükler?
Böyle de kum, var.
Ne iş yapardın? Şoför. Evli misin?
No need for hospitalization.
Şoförüm, ofin. Dört kardeşim var. Ameliyat oldum. Şu anda Fatma babam adı Hakkı. Babam şoför. Fatih sizin.
There is a modification of type 3 thyroplasty as defined by Dr. Mark Rimakel from Luxembourg. He made the same cuts, 3 to 5 millimeters from the midline vertically. Instead of removing a strip of cartilage, he pushed this island of thyroid cartilage inside and sutured the thyroid ala over it. So the tighter you make this suture, the more posterior this segment goes, and the lower the pitch becomes. Here again, the thyroid notch or Adam's apple is lost, but the instability is gone. The instability of thyroid cartilage is gone. So this is a newer version of type 3 thyroplasty. Another modification is also called diamond thyroplasty or baklava thyroplasty, we call it. Anterior commissure relaxation technique. Here, you mark the anterior commissure, and then you go up 5 millimeters, go down 5 millimeters, go laterally 12 millimeters on each side. So you make a diamond-shaped incision around anterior commissure. You elevate the perichondrium, and you push this segment inside. Here, the thyroid prominence is protected, and the instability of thyroid cartilage doesn't exist. So this is what I like most of the time, what I perform most of the time.
26 yaşındayım. İnşaat'ta çalışıyorum.
Ne zaman geldin Türkiye'ye?
2 yıl önce.
2 yıl önce. Sesle ilgili nasıl bir sorunun var?
Nasıl?
Söyle canım bakayım.
Anesthesia. Middle of the thyroid cartilage.
Ne oldu?
We are going deeper. And now the thyroid cartilage exposed. I mark the anterior commissure. I go 5 millimeters superiorly, 5 millimeters inferiorly. Mark them with the electropotry, and then go posterior 12 millimeters on each side.
Olabilir.
Kaç hocam?
This will make a diamond shaped cartilage. Because he's a young man, we won't need oscillating saw. Cutting with a knife is much easier and much safer. And bleeding comes from the vessels of the internal perichondrium, thyroid cartilage. Stop in 7 minutes.
Tuvalet itmelen beni.
As I free this cartilage, I will put it inside, which will
Bir hadi bakayım.
Efendim.
Ses nasıl?
lower pitched voice.
Kalınlaştı mı? Bir hadi bakayım.
Evet.
A. İ.
Leave the window
İ.
right there. I want to fix it.
İ. Valit.
Evet.
This is the window.
Valit.
Efendim.
Bir hadi bakayım.
I will make a crossing suture.
A.
Now I do
İ.
I made parallel suture.
İ.
Keep the window depressed. I will be using silicone bolsters to prevent sutures from tearing the cartilage.
Efendim.
İ. Tuttun mu?
And I'm tying the suture.
Hadi bakayım.
Walid Muhammad Said.
Sutures.
Hadi A.
But now I prefer
İ.
crossing suture.
O.
O.
İ.
İ.
A.
A.
Window pressed.
Bunlar dişte yaşıyorum.
Kaç yaşındasın?
The voice.
24.
Ne iş yaparsın?
Mermerci.
İnşaatlarda mı çalışıyorsun?
Evet.
Sesle ilgili nasıl bir sorun yaşıyorsun?
Valla hocam sesim ince çıkıyor.
İnce çıkıyor. Peki
Bunlar dişte
soyadın ne?
From
Özgür?
Lavatar.
Ha.
Bunlar dişte yaşıyorum. Ankara Mamak'ta çalışıyorum mermerci.
Kaç yaşındasın?
24.
Sesle ilgili nasıl bir sorun yaşıyordun?
Valla önce de inceydi, şu an iyi.
İnce miydi sesin?
Evet.
Ne kadar zamandır ince sesin?
Valla doğuştan beri.
Doğuştan.
Another modification of type 3 thyroplasty, as called by Dr. Haben from US, second class lever. Here, inferiorly based thyroid cartilage flap is prepared. Inferiorly based thyroid cartilage flap is based inferiorly and on the thyroid cartilage itself and also cricothyroid ligament. And this goes 3 millimeters laterally on each side. So it is cut and pushed inside. Again, the thyroid prominence is preserved and there is no instability of thyroid cartilage. So the same thing, relieving, decreasing tension on vocal folds. This is another technique described in literature. There is one endoscopic surgery for voice masculinization. It is called coronal and sagittal release glottoplasty using laser. In this surgery, the anterior commissure is released from thyroid cartilage coronally, so it's a coronal release, and also vocal ligament is released from the vocalis muscle, and this is the sagittal release. Let's see one of my patients. This gentleman is 48 years old. He's cis male. And he had 2 type 3 thyroplasties, 4 months apart. He's still not happy with the frequency of his voice. It was 130 at that time. You see, vocal folds are normal. Anterior commissure is displaced posteriorly. Kaç yaşındayız?
47 yaşındayım.
Ne iş yaparız?
Elektronik mühendisiyim.
Nerede oturuyoruz?
Kütahya'dayım.
Kaç çocuğumuz var?
Bir tane çocuğum var.
He has normal voice actually, normal male voice, but he wants it to be deepened.
Eşim emekli. Kısmen emekli oldu.
Seste nasıl bir sorun yaşıyoruz?
Ses biraz ince geliyor bana. Biraz da kalınlaştırılmasını istiyorum.
Now this is the surgery. Anterior commissure exposed. I'm using diode laser. Cut through the anterior commissure coronally. Then I go deeper to reach the thyroid cartilage. Then I will cut the Broyles ligament from the thyroid cartilage. Now I'm going laterally for sagittal release to release the vocal ligament from the vocalis muscle on both sides. I reach the thyroid cartilage. I'm going lower inferiorly. More sagittal release. And now I'm using scissors to cut the Broyles ligament and expose the thyroid cartilage internally. So this is how I release coronally. This is the end of surgery. So relaxed vocal folds.
Sesle ilgili nasıl bir sorunumuz vardı?
Sesle ilgili biraz ince bir sesim vardı. Lazerle ameliyat oldum. Ses kalınlaştırmak için. 3 ay bir zaman geçti üzerinden.
As a conclusion, if the patient is a normal male with high-pitched voice therapy is the first option. If the patient is transgender male, you should start with hormone therapy plus voice therapy. If it is not successful, then go ahead with the voice masculinizing surgery. Various type 3 thyroplasty available, options available. There is open and endoscopic procedures available, and you can expect 50 to 60 hertz decrease in fundamental frequency in these people. Thank you for your attention.